Steve Jobs had a company, when he was thrown out of Apple the first time, started a company called NXT.
Yes.
And on the next machine, they had a fractal engine running on it. So I know that in those days, when I was still doing technical work, we had mainframes in CMC, and we had this little machine which came in, and we tried to run a fractal on an IBM hard mainframe.
Yes.
And pretty much the compute cycles went for a toss. We had this machine with this engine running it and doing it in real time practically.
Now, look,
It's a different way of computation,
do you know?
but it's very stressful.
Do you know how you turn a triangle into a six-sided star? Well, you add a little triangle in the middle of each line.
Right.
Now, do that again. You've got this line, so you have a little triangle. Then up this line, you have a little triangle. Down this line, you have a little triangle.
Right.
And then you do that again.
Right.
And you end up with something which is infinitely kinky,
Right.
which has an infinite length,
Okay.
but it only surrounds a finite area.
Right.
That's paradoxical.
Right.
This is an example of a particular fractal.
I'm trying to correlate that with medicine in my, my mind as a physician. I understood everything that you said, but I'm trying to correlate that with the pulse waveform because
It's very kinky.
No,
Yeah.
look
Yes,
at
well,
it this
look-
way. I mean, if
Look
you're
at
treating...
look at one of the action potentials.
Right.
It's kinky.
Yes,
It has certain fractal.
but there is sodium pump and potassium and calcium. There is some logic that I can relate to. I need to
But
relate.
if I were to tell
No,
you,
so
that these
if you're
things-
treating a Parkinson's patient, right?
Right.
You're given a syndopa to control the nervous system. Now, syndopa has hallucinogenic side effects, so you're given, anti-hallucinogen. Now, that's
That's not the right way of doing it.
no, but
yes.
that's the way they treat it. I mean,
Well,
my
yeah,
dad
that's
had
not-
15
that's-
years. We saw what was
But
happening.
that's what they were doing to
But
my
now what
stepmom.
MIT is doing is they're getting computer scientists, physicists, and doctors together. They're saying this is all nonsense. We need to treat it at the molecular level, and do a targeted drug delivery into that cell and release that. Problem is how you get it in. No one knows how to do it. Most doctors don't know the effect of a molecule on, a drug molecule on this. So the entire research, there's a research paper that was presented last year at the ACM SIGGRAPH, which talks about how you're using gastroscopy techniques
Right.
to inject that capsule in, which will, pardon the dramatic usage, self-destruct at the cell. And the catch is, are you looking at the current of the blood? Are you measuring it currently? Because this particular capsule will self-destruct at a particular time. What if it hasn't reached its target?